Okay, let's take a deep dive today into something quite specific, actually, a challenging health issue for our pets.
Mm-hmm.
We're looking at your sources on a particular type of urinary stone in dogs and cats,
Mm-hmm.
something called Xanthine Urolithiasis.
That's right. And our goal today is really to unpack this. It's a complex topic. We want to get beyond just like the definition and really understand what's behind it, why it's often so tricky to figure out
Right.
what the options are if a pet is diagnosed, and, what living with this condition really means for the owners too.
And here's where it gets really interesting, I think, because while these stones are rare, apparently quite rare,
Very rare.
diving into them, it sort of illuminates some fundamental biological processes, doesn't it?
Mm-hmm.
And highlights the very real complexities of managing chronic conditions in our animals.
Absolutely.
So we're pulling out the most important insights from the material you shared,
Mm-hmm.
connecting the dots, and trying to figure out the so what for anyone who cares about animal health. Let's get into it.
Okay. So, to start, what exactly is xanthine urolithiasis?
Well, simply put, it's the formation of urinary stones, uroliths, we call them, that are made up mostly of xanthine.
Okay, xanthine, and that's a substance the body naturally produces, right? It's not something foreign.
Exactly. It is. It's a natural product, part of the normal process of breaking down purines.
Purines, yeah.
Purines are compounds. You find them in lots of foods, and the body makes them too. And the material we looked at, it points out these specific stones are quite rare overall, like really rare,
How rare are we talking?
showing up in less than 0.5% of all the stone analyses submitted for both dogs and cats.
It's less than 0.5%. Wow. Okay, that seems incredibly uncommon.
Wow.
So why is it so important to understand if it's, seen so infrequently?
Well, because even though it's rare, the reason it happens and the specific challenges it presents,
Hmm.
they're unique. And they have really big implications for how you diagnose it and manage it long term.
Yeah. Understanding this rare issue actually gives us insight into broader metabolic processes and some significant diagnostic hurdles.
Makes sense. Okay, so tell us then, how does this rare stone actually form? What's going wrong in the body's normal processing?
All right, so it comes back to that purine metabolism pathway. You can sort of think of it like an assembly line, maybe, with several steps.
Okay.
Purines get processed first into something called hypoxanthine. Then that becomes xanthine.
The stuff the stones are made of.
Right. And then xanthine is normally converted into uric acid. And finally, in most animals anyway, uric acid becomes this highly soluble substance called allantoin.
Allantoin. And that's easy to get rid of.
Yeah, very soluble, easily removed from the body in urine, no problem.
So it's like a chain reaction, one thing converting to the next. Is there a key player, like an enzyme, involved?
Absolutely. The central player here, the really key one, is an enzyme called xanthine oxidase.
Xanthine oxidase, okay.
Sometimes it's also called xanthine dehydrogenase, or XDH. Same thing, basically. And this enzyme is needed for two of those critical conversions, turning hypoxanthine into xanthine, and then the crucial step, turning xanthine into uric acid.
Got it. So if that enzyme isn't working properly, things get backed up before they can become that easy to excrete allantoin.
Precisely. That's the core problem. You end up with way too much xanthine building up in the urine. And the sources, they outline two main ways this happens.
Okay, what are they?
The first is naturally occurring. This is often genetic or hereditary. It means there's a congenital defect or maybe a familial deficiency in that xanthine oxidase enzyme activity itself.
So the enzyme just doesn't work right from the start.
Essentially, yeah. It's linked to mutations in specific genes, like the XDH gene or one called MOE-OS, and it tends to be inherited in what we call an autosomal recessive pattern.
Okay, so some pets are just born with this tendency.
Yeah.
What's the other way it happens?
The second way, and this was surprising, it's actually the most common cause in dogs, is iatrogenic.
Iatrogenic,
Yeah.
meaning caused by medical treatment.
Exactly. Specifically, it happens when a dog is given a medication called allopurinol.
Allopurinol.
Yeah.
But wait, isn't that drug sometimes used to prevent certain other types of stones? Like urate stones in Dalmatians?
It is, and that's exactly where the complication comes in. Allopurinol is a xanthine oxidase inhibitor. That's how it works.
Wow.
It's used therapeutically to lower uric acid levels, prevent those urate stones you mentioned common in Dalmatians, dogs with liver shunts, or sometimes for treating conditions like leishmaniasis.
Right.
But if you use allopurinol, especially if the dose is maybe a bit too high, or importantly, if the animal is also eating a high purine diet,
Okay.
it directly blocks that enzyme. It stops the conversion of xanthine to uric acid. So xanthine builds up, essentially mimicking that genetic problem we just talked about.
Wow. So you're treating one stone problem, but could potentially create this other rarer one.
Yeah.
That's a tricky balance.
It really is. A bit of a clinical tightrope, as you say. So yeah, either the enzyme is genetically faulty or a necessary medication blocks it. Either way, you get this backlog of xanthine.
Okay. And you mentioned this makes things challenging.
Right. And here's another wrinkle, a really key one from the sources. Xanthine is described as being only moderately soluble and, crucially, at any urine pH.
Any pH. So acidic or alkaline doesn't matter much for dissolving it?
Exactly. Unlike some other stone types where you can manipulate the urine pH to help dissolve them, like struvite stones, which dissolve in acidic urine,
Right.
xanthine stones are just notoriously difficult to dissolve medically once they've formed. That poor solubility across the board is a major hurdle.
So you generally can't just change the diet or give a medicine and expect existing stones to shrink away.
Generally, no. Not effectively for stones that are already there. The sources mention a possible exception for the iatrogenic ones, the ones caused by allopurinol. If you catch it, stop the allopurinol immediately and get the pet onto a really strict low purine diet. Plus, maybe alkalinize the urine. Maybe they might dissolve, but it's not a guarantee.
Okay.
For established stones, though, especially the hereditary kind, the focus really shifts dramatically. It's not about dissolving them anymore.
It's about getting them out.
Getting them out physically, yes. And then, most importantly, preventing any new stones from ever forming again.
Prevention becomes the name of the game. Okay, so we know what they are and the why behind them. Who's most likely to get these, and what signs might an owner actually see?
Well, the risk varies. That naturally occurring kind, the genetic Xanthinuria, it's reported as maybe slightly more common in cats than dogs, but again, it's rare in both species.
What?
However, in dogs, remember that allopurinol-induced form is the most frequent cause we see, and that could potentially affect any breed, any age, any gender, really, if they're receiving the drug.
Gotcha. But are there specific breeds mentioned more often for the natural, the genetic form?
Yes, definitely. For dogs, the naturally occurring cases in stones have been particularly noted in young Cavalier King Charles Spaniels.
Ah, Cavaliers.
Yeah, there's a suspected autosomal recessive inheritance pattern there. It's also been reported in breeds like Dachshunds, sometimes associated with kidney failure in them, apparently toy Manchester Terriers, English Cocker Spaniels, Chihuahuas, and even mixed breeds.
Interesting list. Any sex predilection in dogs?
Yeah, males seem more prone to actually forming the stones than females in dogs.
And what about cats? You said it's rarer, but maybe slightly more common naturally. Any breeds?
The data mentioned didn't show a really strong breed link for cats based on Minnesota Urolith Center data from like 1981-2014, but they have been reported in domestic shorthairs and Himalayan cats.
Okay. And age and sex trends in cats?
In cats, the material suggests they affect adult males more often than females, roughly 2/3 male to 1/3 female. And the average age was around 3.3 years, but with a really wide range from like 2 months old up to 13 years.
Wide range indeed. Okay, so the clinical signs. What might actually prompt a vet visit? What does it look like?
Well, the signs are often frustratingly nonspecific. They can easily mimic other, much more common issues, like a simple urinary tract infection or other types of stones.
Like what sort of signs?
It really depends on where the stone is, how big it is, how many there are, and crucially, if it's causing any blockage. But common things are needing to urinate more frequently, that's polyuria, painful urination, which is dysuria, straining to urinate, stranguria, and seeing blood in the urine, hematuria.
Oh, classic lower urinary tract signs.
Exactly. The sources also mention that occasionally an owner might actually see the pet pass small stones. They're described as typically smooth and yellow.
Actually seeing a stone pass? That seems like a pretty big clue.
It absolutely can be, but you might not see it or it might not happen. But here's a really, really critical point. Just like with other urinary stones, a complete blockage of the outflow tract, the urethra usually,
Right.
that is a life-threatening emergency. This is when the animal is clearly trying desperately to urinate, straining hard, but nothing, or maybe just a few drops are coming out. It's incredibly painful.
Yeah.
And it can rapidly lead to serious complications, kidney failure, toxin buildup, severe electrolyte imbalances, things like lethargy, vomiting, collapse. It's bad news.
And that's more common in males.
Unfortunately, yes, because of their longer, narrower urethra, they're just anatomically more prone to getting completely blocked.
That sounds absolutely terrifying for an owner. What about stones higher up, like in the kidneys or the tubes leading from them? The ureters?
Yeah, stones in the upper urinary tract, kidneys or ureters, seem less common with Xanthine Urolithiasis. Often, they might not cause any obvious signs. They can be asymptomatic.
Silent, but potentially damaging.
Right. If they do cause a blockage higher up, they can lead to hydronephrosis, that's swelling of the kidney, because urine backs up and potentially impact kidney function over time. In severe cases, it could even lead to kidney failure.
And you said sometimes no signs at all.
Yep. Some animals can be completely asymptomatic, which makes diagnosis even tougher. Just found incidentally, maybe. And very, very rarely, the urine itself might look weird, like a distinct mustard yellow color, apparently, if there's a super high concentration of xanthine crystals.
Oh, mustard yellow urine. Okay, so non-specific signs, potential life-threatening obstruction, sometimes no signs at all. This sounds incredibly challenging to diagnose. You really have to suspect it.
It absolutely is a diagnostic puzzle, and the sources really hammer home why.
Right.
The clinical signs are the first hurdle. They look like so many other things, right?
Yeah.
But the key challenge, the thing that makes these stones particularly sneaky, is that they are typically radiolucent.
Radiolucent. Okay, remind me. That means you can't see them on a regular X-ray, right?
Exactly, invisible on plain X-rays. And this is such a crucial detail because plain X-rays are often, the first go-to imaging test when a vet suspects urinary stone.
Right, you expect to see them light up.
Yeah. If the stones were made of calcium oxalate or struvite, which are much, much more common, they likely show up pretty clearly as white shapes on a standard radiograph. But xanthine stones, they just don't have the mineral density. They blend in.
The invisible stone. So if a vet takes an X-ray, sees nothing, they might think, oh, it must be an infection or something else entirely.
Precisely. It can easily lead to misdiagnosis, or at least a delayed diagnosis, if the possibility of radiolucent stones like xanthine isn't specifically considered.
So how do you find them then if X-rays don't work well?
You need other imaging methods. Ultrasound is super valuable here.
Okay.
Ultrasound uses sound waves, so it can visualize stones in the bladder, urethra, kidneys, ureters, regardless of what they're made of. It's also great for looking at the bladder wall itself, checking for thickening and detecting that kidney swelling, hydronephrosis, if it's present.
So ultrasound is key. What else?
Contrast radiography is also essential. This is where you inject a special contrast dye into the urinary tract.
Oh.
Then you take X-rays. Because the xanthine stones are radiolucent, they don't absorb the dye, so they show up as voids or filling defects within the contrast-filled bladder or urethra.
Like a dark spot where the stone is physically blocking the contrast from filling that space. Makes sense.
Yes, that's a good way to picture it. And the sources also indicate that a CT scan is actually the most sensitive imaging technique available.
Even better than ultrasound or contrast.
For detecting even very small radiolucent stones, yeah. And for getting a really precise picture of their location and whether they're causing an obstruction, CT is considered top tier.
Okay. What about looking at the urine itself? Does the urinalysis give any clues? Can you use the xanthine?
Well, a urinalysis is always part of the workup, absolutely. And you might see crystals in the urine sediment when you look under the microscope.
Uh-huh. So that's the clue.
It's a clue, but here's another diagnostic hurdle. Under a standard light microscope, xanthine crystals often look very, very similar to other types of crystals, particularly urate crystals.
Oh,
Yeah. They're often described as sort of amorphous or yellowish-brown, maybe little spheres. You simply cannot reliably tell them apart from urate just by looking.
So seeing crystals says something is going on, but not what kind of crystal necessarily.
Exactly. The urine pH might also be a factor. The sources mention an acidic pH tends to enhance xanthine crystallization, but the crystals themselves aren't definitive.
Okay, tricky. What about blood tests? Anything show up there?
Standard blood work, like a chemistry panel or CBC, is usually normal. Unless there's an obstruction causing kidney injury, then you'd see changes like azotemia.
Right.
However, the sources point out a potentially key diagnostic blood finding if Xanthinuria is the underlying issue. You'll likely find very low or even undetectable levels of uric acid in the serum.
Low uric acid.
Yeah, which makes sense if the enzyme converting xanthine to uric acid isn't working.
Right, the uric acid isn't being made.
Exactly. And coupled with that, you'd expect to find abnormally high levels of both xanthine and hypoxanthine in the plasma and also in the urine.
Okay, so low uric acid, high xanthine and hypoxanthine, and stones you can't easily see on X-ray. That combination starts painting a pretty strong picture.
It does. It absolutely should raise suspicion for Xanthinuria. But the material we reviewed is very, very clear on this point. The definitive diagnosis, the absolute confirmation, requires urolith analysis, and it is mandatory.
Mandatory. So you have to get a stone out.
You must retrieve the stones. Ideally, if the pet passes one, the owner collects it, or they're removed via catheterization or that flushing technique, urohydropropulsion or cystoscopy, or most commonly, surgery.
Send it off.
Send it to a specialized diagnostic laboratory. These labs use specific quantitative analysis methods, things like infrared spectroscopy or X-ray diffraction, to chemically analyze exactly what the stone is made of.
Not just looking at it.
No, proper chemical analysis, to confirm definitively that it's primarily xanthine. This is the only way to be absolutely certain and, crucially, to guide the correct prevention strategy moving forward.
So you really can't rely on the imaging or the urine or blood tests alone for the final diagnosis. You need the stone itself analyzed.
Correct. Not for definitive confirmation. While those tests build a strong case, stone analysis is the gold standard. Other conditions might mimic some aspects. The sources also mention other tools like specialized urine-purine analysis using techniques like HPLC. That can confirm the biochemical imbalance if you just can't get a stone sample. And of course, genetic testing is available for some breeds to identify the specific mutations.
Right. Get the stone, analyze the stone. Okay. So once you have that definitive diagnosis confirmed, what's the treatment approach? You mentioned earlier that medical dissolution, dissolving them, isn't typically an option for existing stones.
That's really the key difference from some other common stone types. The sources are quite firm. Medical protocols to consistently dissolve existing, already formed xanthine uroliths are generally not effective. Once they're there, they usually stay there unless removed.
So you can't just feed a special diet or give a pill and expect them to reliably shrink away.
Not for established stones, no. Again, that possible exception may be for the allopurinol-induced ones if caught very early and managed aggressively. But for most cases, especially the genetic ones, treatment really focuses on two things: physically removing the stones that are present, and then critically putting a rigorous plan in place to prevent new ones from forming.
Okay, removal is necessary. And if a pet is blocked, you said that's an emergency.
Absolutely. A urethral obstruction is priority number one, life-threatening. Requires immediate stabilization, IV fluids, managing electrolyte problems like high potassium if the kidneys are affected, and then prompt relief of that obstruction. That might involve flushing the stone back into the bladder, retrograde urohydropropulsion, or sometimes emergency surgery on the urethrotomy.
And block them first. And once the immediate crisis is managed, how are the stones typically removed from, say, the bladder?
Well, for very small stones, maybe less than 3 or 4 millimeters, a technique called voiding urohydropropulsion might be attempted under anesthesia. You basically position the animal upright and use fluids to flush the stones out. But for larger stones, or if there are many stones, particularly in the bladder, surgery, specifically a cystotomy, which means cutting into the bladder, is described as the most common and reliable method for complete removal from the lower urinary tract.
So surgery is often needed. Are there less invasive options?
Yes, there are. More advanced, minimally invasive options, like using cystoscopy, inserting a small camera into the bladder to guide laser lithotripsy, where you break the stones up with a laser.
Wow.
Or using tiny baskets passed through the scope to grab and remove stones. These are becoming more available, but usually require specialized equipment and expertise, often at referral centers.
Okay, so you physically remove the stones, but you really stress that preventing new stones is crucial and lifelong. How on earth do you achieve that for a stone you can't easily dissolve?
This is where the real work begins, and it becomes this dedicated, ongoing partnership between the owner and the vet. The primary goals for prevention are basically twofold.
What are they?
1, minimize the amount of xanthine the body produces and excretes in the urine. 2, modify the urine environment to make it less friendly for stone formation. That means making the urine as dilute as possible and keeping it alkaline.
Okay, minimizing xanthine production first. How do you do that?
Dietary modification is absolutely fundamental. The sources strongly advocate for using low-purine prescription diets.
Prescription diets, specifically low purine.
Yes. These foods are specially formulated with significantly reduced levels of those purine compounds, the precursors to xanthine. So less purine in means less xanthine produced and less ending up in the urine.
Makes sense. Do these special diets also help with the urine environment, making it dilute and alkaline?
They usually do. They're typically designed to help promote a more alkaline urine pH, aiming for above 7.0. Now, while xanthine's solubility doesn't change dramatically with pH like some other stones.
Right, you said it's poorly soluble anyway.
Correct. But a more alkaline pH is still generally preferred. It doesn't hurt and might help a bit with crystal formation. But crucially, these diets, especially if you feed the canned version or if you add significant amounts of water to the dry kibble.
Increasing water intake.
Yes. They significantly increase the pet's total water intake. And diluting the urine is absolutely paramount. A dilute urine is simply less likely to become supersaturated and form crystals and stones. The goal is to achieve a really low urine-specific gravity. The sources mention targets like less than 1.020 in dogs and less than 1.030 in cats. Very dilute.
So low urine intake, promoting alkaline pH, and pushing water to make the urine very dilute. Are there specific common foods or treats that owners absolutely need to avoid because they're high in purines?
Yes, the sources are quite clear on this. Avoid high purine items like organ meats, think liver, kidney, many types of red meat, some seafood, and yeast products can also be high. High-protein treats and any table scraps should generally be completely off limits unless specifically discussed and approved by the vet. The sources explicitly state that failure to restrict the diet properly can really exacerbate Xanthinuria, especially in animals that are, or were, on allopurinol.
Strict diet is non-negotiable then. And if the cause was allopurinol, I assume stopping that drug is a key step in prevention.
Absolutely essential. If the xanthine stones were diagnosed as being induced by allopurinol, then discontinuing that medication is a critical part of the prevention strategy, alongside the diet.
Okay. What if the special diet alone isn't quite enough to keep the urine pH alkaline in that target range above 7?
Good question. In those cases, medications specifically for urinary alkalinization might be added, things like potassium citrate or sometimes sodium bicarbonate.
Okay.
These can help consistently maintain the urine pH in that desired range, to say 7.0 to 7.5. This often requires the owner to get involved with monitoring too. By regularly checking the pet's urine pH at home using simple urine dipsticks to make sure the diet and any medication are actually achieving the target pH.
Right, home monitoring. Now, is there anything that should never be given to a pet diagnosed with xanthine stones, like a major contraindication?
Yes, there's a very important one highlighted in the sources. Do not give allopurinol to dogs or cats that have been diagnosed with the naturally occurring, the hereditary form of Xanthine Urolithiasis.
Because their problem is already the enzyme.
Exactly.
Yeah.
Their underlying problem is already a deficiency or defect in the xanthine oxidase enzyme that allopurinol inhibits. Giving the drug would directly make their condition worse by blocking any remaining enzyme activity they might have had. It's completely counterproductive.
Okay, crucial point. So, summary of prevention. Strict, low purine diet, push water intake like crazy, maybe add alkalinizing medication if needed, monitor pH, and absolutely no allopurinol if it's the genetic type.
Yeah.
With all that, what's the long-term outlook? What's the prognosis really like?
Well, the sources state that the prognosis is generally considered guarded regarding the likelihood of recurrence, unless there is truly dedicated lifelong prevention.
Guarded even with effort.
Well, removing the stones usually resolves the immediate clinical signs, the discomfort, the straining, all that. But the material really emphasizes that recurrence rates are high if those preventative measures aren't followed very strictly and consistently.
A high recurrence rate. That really underscores the lifelong challenge, doesn't it?
It absolutely does. And it's why that prevention piece is just so paramount. The prognosis might be somewhat better for the iatrogenic cases, the ones caused by allopurinol, if the drug can be stopped permanently and the diet is effectively managed.
Okay.
But for the hereditary cases where that underlying metabolic defect just persists, you can't cure it, the long-term prognosis for preventing new stones is definitely more guarded.
And are there other long-term risks for those hereditary cases?
Yes, unfortunately. They are considered at higher risk for long-term kidney issues. This could include stones forming within the kidneys themselves called nephroliths, or potentially kidney infections, pyelonephritis. This is thought to be due to xanthine potentially depositing in the delicate kidney tubules over time.
So it really requires constant vigilance from the owner. What does that ongoing monitoring actually involve day to day or month to month? What would an owner need to expect in terms of follow-up care?
Management is definitely a significant commitment. The sources outline a pretty comprehensive follow-up plan. First off, remember that stone analysis is mandatory for any stone retrieved, always.
Right.
Immediately after removal surgery, follow-up imaging, maybe within 24 hours or shortly after, might be recommended just to confirm that all the stones were successfully removed.
Get a clean baseline.
Exactly. Then, lifelong monitoring is essential.
What kind of monitoring specifically?
Regular urinalysis and urine culture, maybe every 1 to 3 months initially while things are stabilizing, and then lifelong, probably every 3 to 6 months.
Checking what in the urine?
Checking the urine pH to ensure it's in the target range, checking the specific gravity to make sure the urine is dilute enough, looking for any crystals, and monitoring for urinary tract infections because UTIs can complicate any stone disease. Urine purine analysis might also be repeated periodically to check the biochemistry.
Okay. Urine checks. What else?
And importantly, regular imaging. Ultrasound is often preferred because the stones are radiolucent, but maybe contrast x-rays depending on the case. This would be maybe every 3 to 6 months initially, and then potentially lifelong every 6 to 12 months.
Why so often with imaging?
The goal is to detect any new stone formation as early as possible, when they're small, before they grow large enough to cause clinical signs, or worse, an obstruction. Catching them early gives more options.
That makes sense. Blood work too.
Yep, periodic blood work rechecks would be standard. And if it's a known genetic case and the specific mutation is identified, genetic testing might be relevant for breeding counseling purposes, advising against breeding affected animals or their close relatives.
That sounds like a lot for an owner to take on. Financially, emotionally, time-wise. What are the absolute key things a veterinarian would need to hammer home to make sure an owner really understands when their pet is diagnosed with this condition?
Yeah, it's crucial communication. Based on the sources, several points are absolutely vital for client education. The vet needs to clearly explain the rarity, first off, but also that diagnostic challenge, especially the radiolucency, why initial x-rays might have been negative.
Manage expectations there.
Exactly. They need to clarify whether the cause is thought to be genetic or drug-induced, as that impacts management. They absolutely have to emphasize that existing stones generally cannot be medically dissolved. That's a big one.
Right. No magic pill for form stones.
And they must make it crystal clear, unequivocally, that prevention is a lifelong commitment. It requires strict, unwavering adherence to the diet and potentially medication forever.
Lifelong commitment. That's a
Right.
very significant message for someone to absorb about their pet.
It absolutely is. And the vet needs to be really transparent about the high recurrence rate if those preventive measures falter, even temporarily. Diligence is key.
What else is critical for them to grasp?
The absolute paramount importance of the diet. Reinforces only the prescribed low purine food. Strict avoidance of forbidden treats and scraps. No exceptions unless cleared. And critically, hammering home the importance of increasing water intake to ensure very dilute urine can food, adding water, whatever it takes.
Okay.
The owner might also need practical instruction on how to monitor their pet's urine pH at home with the dipsticks, if that's part of the plan.
And reminding them about the emergency signs again.
Definitely. Reiterate. Straining persistently without producing urine is an immediate, potentially life-threatening emergency. Go straight to a vet, day or night, no waiting.
Right.
Also, being open about the potential financial implications, the cost of diagnosis, which can be involved with advanced imaging, potentially surgery, and then the lifelong monitoring, prescription food, and maybe medication costs. It adds up.
Yeah, that's an important practical aspect.
And finally, if it is a known hereditary condition, advising against breeding that affected animal or its close relatives, and potentially encouraging genetic testing for siblings or other family members. And mentioning that for complex or frequently recurring cases, referral to a veterinary specialist, like an internal medicine specialist or surgeon, might be beneficial.
Okay, so let's try and wrap this up. What does this deep dive really teach us? We've explored this specific metabolic glitch, basically, that leads to a stone problem, which is rare. Incredibly difficult to spot on initial imaging because it's radiolucent.
The invisible stone.
Right, and generally can't be dissolved once it's actually formed.
Exactly. I think the absolute key takeaway, the bottom line from all this material, is that successfully managing this condition hinges almost entirely on rigorous lifelong prevention.
Prevention, prevention, prevention.
Yeah, it means strict adherence to that sessile low purine diet, consistently ensuring the urine stays dilute and alkaline, and just vigilant, regular monitoring urine tests, imaging to catch any potential recurrence as early as possible.
Understanding these details From the intricacies of the purine pathway and that enzyme to the diagnostic challenge of radiolucency
Mm.
and the fact that they're non-dissolvable, it really helps you grasp the complexity of this condition and the truly dedicated long-term care that's required for a pet living with it.
It does. This condition is such a powerful example, isn't it, of just how intricately connected genetics, diet, and enzyme function are within the body. And maybe it leaves us with an important question for you, the listener, to think about.
Oh, yeah.
Given the need for such diligent, such intensive lifelong management for a complex, often frustrating, non-dissolvable issue like this, how does that necessity shape or maybe even reshape the ongoing partnership and the level of communication required between a pet owner and their veterinarian? It really demands a different kind of teamwork, doesn't it?